Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy, Walden University, and I wanted to go over this in this audio/video about reducing stigma. This is from the Centers for Disease Control, so it's a reliable source. And stigma, specifically, they tried to write this for COVID-19, but I think that this goes beyond COVID-19. I've given several examples of places where individuals with hypertension, diabetes, obesity, all of these, and hypertension being treated at an early age, all of these can lead to certain types of stigma. And the types of stigma that individuals experience varies from the type of socioeconomic status the individual belongs to, or in terms of not getting enough food, where people going into food banks while others are not. And so even simple things like electronic balance transfer or EBT cards are a certain color, used to be a certain color with a bright color so that others could see it. And so these types of socioeconomic status exists not just here, but throughout Middle Eastern, North African countries as well. So it's good to contextualize this in the perspective out of a global level. And you'll see here it's COVID-19, but similar things things took place when we were going with HIV and trying to understand it, and it was associated with people with a certain sexual orientation, even though it was quite common in the general population. So understanding, instead of stereotyping, discriminating, stigma, and other negative behaviors toward others, instead understand the reasons behind the stigma. Of course, the harmful effects of stigma can occur when people link a disease such as COVID-19 or anything with a population, community, or nationality. So if you say that mostly African Americans get diabetes, well, that's not, first of all, it needs to be looked at it in the basis of what COVID-19 or the disease is doing. For instance, in diabetes, there might be some lack of understanding that it needs to be refrigerated, and so that can cause misunderstanding. Also, stigma. So stigma and discrimination as it pertains to each disease. Racial and ethnic minority groups, including Asian Americans, Pacific Islanders, and Black or African Americans, experience stigma more so than others. And this was the group that was most heavily affected by COVID-19. So people who tested positive for COVID-19 have recovered from being sick with COVID-19 or were released. Emergency responders or healthcare providers, other frontline workers, so they might have been in more contact, so individuals might have had stigma surrounding that. Even underlying health conditions such as cough might have been viewed as having a stigma. And then people living in close quarters, such as people experiencing homelessness, that might cause a lot of different diseases as well, tuberculosis and COVID-19. But it's important to understand that stigma hurts everyone. There's fear or anger toward ordinary people instead of focusing on the disease that is causing the problem. So if you just stigmatize everyone in a certain ethnic group, then that makes everything worse for all the people. Because people, if they're stigmatized, they're going to hide the symptoms. They're not going to reveal everything about the disease. So keep them from that keeps them from seeking health immediately, seeking care, and then that prevents individuals from adopting healthy behaviors because they're not getting to the treatment that they need because of the stigma that they're experiencing. So groups who experience stigma may also experience discrimination. That's not always the case, but discrimination can take the form of anything from people avoiding or rejecting you to getting denied healthcare, education, housing, or employment. This is where the 5 domains of the social determinants of health take place. Verbal abuse or physical violence, these are all parts of stigma that are around. And physical and I would add also sexual violence, and having a kit available in the emergency department. So there's all different types of stigma, and so community leaders and public health officials can help prevent this stigma as well by maintaining the privacy, confidentiality, quickly communicating the risk or lack of risk, correcting negative language, so myth busting. And I encourage you to take the quiz that's on here as well. That can cause stigma by sharing accurate information about the virus spread. So, by the way, I did receive 1 wrong out of the 10. Speaking out against negative behaviors and statements, including those on social media. With the propagation and advent of social media, there's a lot of different myths and in some ways attacking certain groups. And it's better to stay away from that and not make that part of your belief system. Making sure that images used in communication show diverse communities, not to reinforce stereotypes. Media channels, news media, social media must be against stereotyping, thanking healthcare workers, responders, or others working in the front lines, and then suggesting virtual resources for mental health. So for more information, you can visit these websites. But this is all that's there. Thank you for listening.